I really see nurses as taking a very leading role as we move forward with legalization of recreational cannabis, as well as the current medical cannabis system that exists in Canada. And nurses have been fairly silent on this issue. And I was talking to Christy today about how I felt that the LPNs were actually being quite bold and moving forward and putting together some practice standards and some information to their members. Because I haven't seen that across a lot of other nursing groups, including the RNs and the nurse practitioners. I think it's about to happen, but it's great to see you guys being very proactive in trying to support your members in dealing with what is a burgeoning kind of health issue in Canada that's going to get even bigger. As Christy mentioned, I'm at the University of Manitoba. I just moved back home after being away for 20 years, so it's been great to be back. And you know, the reason that I moved into this field of cannabis, I call myself an accidental cannabis researcher, and that's because I came to this field by accident. I have been mainly focused in the area of complementary and integrative healthcare, focusing on such things as natural health products, acupuncture, traditional Chinese medicine, and the possible role of those therapies in cancer populations, and doing a lot of knowledge translation and education programs around the issue of complementary therapies. And I think someone kind of saw my work and wanted to do some research on cannabis, and they really couldn't find many open doors. And as a former oncology nurse, I had witnessed many of my patients have to kind of sneak out of the ward to use cannabis to help them cope with some of the symptoms that they were experiencing. And I always felt that that wasn't quite right, and that we should be doing a better job of counseling patients on their use, documenting patients' use, and monitoring the possible positive and negative outcomes. And that was about 10 years ago, and I'm still moving forward and doing some health services and policy research in the area of medical cannabis. And as legalization comes, I will probably be focusing a lot on the non-medical use as well. So let's get started. And I just need to get my bottom slide. There we go. I do always want to speak to my disclosures. And the only bit of funding that I've received beyond the peer-reviewed Tri-Council funding in Canada has been through the MyTax funding program, which is really to support training in research. And it's a partnership between the Canadian Association of Medical Cannabis Dispensaries, the Canadian Consortium for the Investigation of Cannabinoids, which really focuses on education and research, and AFRIA, which is actually one of the licensed producers that exists in Canada. This is an unrestricted educational grant, and they don't have any influence on my research. And I feel like I balance out having industry involved by having peer-reviewed research as well as the dispensaries as part of this project. And it's funding my PhD student, Riel Kapler at UBC. So in terms of learning objectives, you know, I just want to give a bit of an overview of past and current Canadian policy related to medical and recreational cannabis. Because I think it's important when we're talking to patients and family members that they understand what is the current regulation and what is the legal status of cannabis at this time and moving forward. Also, I'm going to speak briefly about some of the research that we have done and are currently doing around patients' experience of medical cannabis. And I think this is really important because it puts context around your patients' experiences when they may want to talk to you or they may want to use medical cannabis in the clinical setting or the community setting. I'm going to briefly talk about some of the potential risks and benefits that we currently understand related to cannabis use. And then I'm going to wrap up just talking about the LPNs as well as the nurses' overall role related to cannabis use in Canada. And I hopefully will have some discussion at the end in terms of some of your thoughts about that as we move forward with legalization in Canada. So let's start really quickly. You know, when I first started doing research in this field, you know, I heard such language as things like marijuana. The Health Canada was calling this marijuana with an H, which is actually quite a derogatory, stigmatized term. And it has only been in the last 6 months that Health Canada has finally used the correct terminology, which is cannabis. But you may be aware of a lot of other words that are out there. And it's been very interesting seeing what's going on Twitter and when the media reports started coming out around legalization, that we're still seeing words like pot, weed, you know, grass being used. And these are really words that I think stigmatize what is a plant product that may have some medicinal benefits. And I think it kind of demeans the conversation that we have with patients when we're using this type of language. So I'd encourage you that if you're talking about cannabis to actually use its correct terminology. And there's many more. Now, in terms of cannabis use, we know from a non-medical or recreational perspective that just over 10% of the Canadian population, and this is back in 2013, so this might have gone up a little bit, but just over 10% of people over the age of 18 report using cannabis at some point in the past year. And we see the largest segment of Canadians using it in the year previously in those that are 15 to 24. So really youth and young adults seem to be the highest consumers of cannabis. And that rate is double for males versus females. So there's definitely a gender influence on the use of cannabis. We also know that in terms of people that are using it daily, we see almost 30% of people over the age of 18 are using cannabis on a daily basis, which, can be concerning when you start looking at things like cannabis use disorder. There is some geographical differences in Canada. We see the highest rates being in British Columbia, which may not be surprising given the illegal and illicit industry that's been going on there for many years. And then the lowest rates are in Saskatchewan, which is kind of ironic because that was, it's one of the homes of where there's been a lot of research on hemp, as well as some of the first LPs were situated in Saskatchewan. Now, when we turn to medical cannabis, back in 2011, we had, about 420,000 Canadians were reporting that they were actually using cannabis for medical purposes, which it's been quite interesting because the number of Canadians that have reported using cannabis for medical purposes has never really caught up with the number of people that are legally authorized to use it for medical purposes. And there's been some research in Canada to suggest that probably it's closer to 1 million Canadians are framing their cannabis use in a therapeutic manner. And so if you think about it, 1 in 5 adults are reporting using cannabis for a therapeutic reason, and half of those individuals are using it for chronic pain. And that's things like arthritis, back pain, as well as things like migraines and headaches. What's interesting is that, just last fall, we saw close to 100,000 Canadians being officially registered in Health Canada's Access to Cannabis for Medical Purposes regulations. That has now well jumped over 100,000 in the few months that have passed, and we're seeing this almost exponentially grow as more and more licensed producers come on board and more health professionals are willing to authorize its use. So let's just talk a little bit about what is cannabis, though. So, it comes from the Cannabis sativa plant, which is also known as hemp. This is a very fibrous plant that has been around for absolutely centuries, and it's been used by humans not only for its intoxicating effects, but also because its fibers are used for clothing, for paper, and also it's been used for other medical purposes beyond it just having this psychoactive effect. When we think about cannabis, it's not just one thing, though. When you look at the whole plant, it's made up of over 130 and counting active compounds that we call cannabinoids. It also contains other components called terpenes, and there's been some suggestion there's over 100 different terpenes in cannabis. And these are really the aromatic oils and they're also known as hydrocarbons if you're coming from a pharmacological perspective. And they really provide that characteristic smell of cannabis. And we're just starting to kind of tease out how these terpenes and these cannabinoids work together, as well as what is their independent health effects. When we look at the cannabinoids, the one that's most well known is THC, and it's the one that has the psychoactive effect that is mostly associated with cannabis. But we also have other ones that we're just, again, starting to realize have some really clear physiological effects on the body. We have cannabidiol, CBD, which has a whole host of effects. It's an antipsychotic, it's an anticonvulsant, it has an antioxidant effect, and it's also thought to have an anti-inflammatory and an analgesic effect as well. Then we have cannabinol, CBN, which does have some weak psychoactive properties and is thought to have a real role in terms of managing sleep disorders. The big issue with these cannabinoids and with using the whole plant, and why you see so many patients being resistant to moving towards the pharmacological forms of cannabinoids, things like nabilone, is that when they use the whole plant, there's thought to be an entourage effect. where THC, CBD, and CBN and the other cannabinoids and terpenes work together, sometimes offsetting some of the negative side effects of the cannabinoids and perhaps actually working synergistically and making the effect more pronounced. We're really just starting to tease that entourage effect. There's been some argument lately that that doesn't really exist. But some of the leaders in the field are still insisting that there are interactions and we need to do a lot more research in understanding them. Now, a lot of nursing schools and programs, when I talk to people about, cannabis, and I mentioned the endocannabinoid system, and a lot of nursing schools are saying, this is not something that we teach. It's not even something that we're really aware of. And I think it's really important that we recognize that our body has this endogenous system that's comprised of cannabinoid receptors, and particularly we call them CB1 and CB2, and they're throughout our whole body. The CB1s tend to be in our nervous system, our brains, as well as some of our organs. It's the one that usually is related to the psychoactive effect. But then we have the CB2 receptors, which seem to be much more linked towards the immune system. And when we look at these endogenous cannabinoids, they appear to act as neuromodulators and immunomodulators, and they have a whole host of effects when these are stimulated in a lab setting. Things like, improving appetite. They seem to impact motor learning. This has been research done with rats. They impact the perception of pain. They have an impact on reducing inflammation as well as calming muscle spasms. And again, they seem to have a sedated effect, so impacting sleep. And this is just a little diagram that kind of points out to you, where some of these, THC, CB1, and just how we see the most of it being in the brain, but we also see it through other parts of the body, particularly along, the spinal column. And then we have our CB2s, which we also see in the immune system, but also within some of the peripheral organs, such as the spleen. So let's just quickly talk about some of the policies that have existed in Canada related to this. So back in 2001, because of the pressures from Canadians that were using this for therapeutic purposes and were finding themselves, basically engaging in criminal activity to access what they saw as a medication, we saw the Marijuana Medical Access Regulation, or the MMAR, come into effect. And they allowed people that were authorized to either produce it personally, to designate someone to produce it for you, which was particularly for people that were physically unable to grow their own plants or were not situated in a living arrangement where they could produce their own plants, or they went through one federal producer, Prairie Plants, which was actually in a mine in Flin Flon, Manitoba. This authorization process was incredibly cumbersome. It was about a 25-page document that only physicians or specialists were allowed to fill out. And it was for a very restricted list of health conditions that were unresponsive to conventional treatment. By the end of the program, we had just under 40,000 Canadians that were approved under the MMAR. Well, there was a lot of legal cases about this, that people had a lot of restrictions from accessing the program. There was a lot of gatekeeping behavior that occurred. And the actual product that was being grown in Flin Flon was very dry. It kind of lacked THC to a significant amount, and people were finding it unhelpful. And in fact, they found it very difficult to use. And so we saw the MMPR come into effect in 2013, which really had the goal about maintaining reasonable access to medical marijuana, but also addressing some of the safety and security risks that arose from people either having it designated in terms of its production or personally producing it. We saw home invasions. We saw people that were concerned about electrical fires, about mold, black mold in houses where they were growing it. So the MMPR was trying to address this. And they also tried to reduce the amount, and they actually said that it was now illegal to personally produce it or to have a designated producer. And instead, they had licensed producers that had to go through a very lengthy approval process to provide medical cannabis through a courier service. They started with only 14, which made it tough to serve the 40,000 Canadians that were using it. And they've now, by the end of the program, had about 30 licensed producers that were approved. They reduced the documentation down to only 2 or 3 pages, from a physician, and they also added in the possibility of a nurse practitioner being able to authorize individuals to access a restricted amount of cannabis. And this was a maximum of 150 grams, which was broken down to about 5 grams a day over a month period. They limit it only to dried medical cannabis. And as many of you may be aware, a lot of patients don't want to just use dried medical cannabis. They want to use oils, tinctures, edibles. But this program really restricted people legally to just dried medical cannabis. And by the end of the program, we had about 48,000 Canadians that were registered. So we were in the midst of a research project, attempting to look at the impact of moving to the MMPR, when all of a sudden we had numerous court injunctions and decisions come down that actually halted the MMPR from coming into effect. And really the big case was around a large, which really challenged the affordability of medical cannabis that were being produced by the LPs. Because we had only a few LPs online, the prices were very expensive, to the point that it was cheaper to get it from an illegal street source than it was to actually go through the LPs. And as a consequence, people that were authorized under the previous legislation to possess and produce their own marijuana, their own cannabis, were allowed to continue to do so until the decision came down that, in fact, this MMPR was unconstitutional and that they had to create a new medical marijuana platform. There also was a protest, another legal case by Smith that looked at going beyond the dried medical cannabis, and people wanted to have access to the oils and to the buds as well. Tinctures were still considered, though, illegal at the time, as well as edibles. So just last year, we came out with the Access to Cannabis for Medical Purposes regulation, which allowed personal production. It went back to allowing designated producers as well as the licensed producers, which we're now up to 40, and I've even heard now we're up to about 46. So it's growing quite rapidly, and now that we have legalization coming on board, it's growing even more quickly as various businesses are attempting to kind of get set up. There's still the limits to 150 grams per month. However, if they want to produce their own, they're allowed a gram of dried cannabis. Sorry, I think I've written that one wrong. But if you're growing it at home, you're allowed 5 indoor plants or 2 outdoor plants. But there's very specific rules in terms of how to produce it, how to store it, how to ensure security. And the big thing is making sure there's no diversion to illicit operations or to children or to youth. The authorization remains being physicians or a nurse practitioner. However, to my knowledge, and I was just at the Canadian Nursing Association, we don't yet have any of the colleges of nurses that have actually allowed NPs to authorize cannabis. I've heard of one NP in BC who's been able to authorize it, but at this time, there's a lot of conversations going on at the associations, but NPs have not been allowed to access cannabis as part of their formulary at this time. As I mentioned, we now have over 100,000 Canadians that have been approved through these new regulations. Sorry, that's a lot of regulations. I think it's important to understand the history, because for some individuals, they've been part of this system for close to 20 years. So in terms of legalization, Uruguay is actually the first country in the world that has legal cannabis. A lot of people don't understand that because they immediately start talking about Amsterdam. But Amsterdam has a decriminalized system. They have not legalized cannabis. We also have seen individually in the United States, various states that have stepped forward to legalize it, despite the fact that cannabis is illegal at a federal level. So there's been a lot of confusion related to that. And in Canada, April 13th, so I've been madly trying to read through my massive Bill 45, the Cannabis Act was actually tabled in Parliament with the intent to bring it into force by July 2018. There's a lot of questions, which I'm going to talk a little bit about in terms of how non-medical cannabis is going to be regulated and distributed in Canada. And that's because the federal government has tasked the provincial governments to decide individually how they're going to be regulating and distributing it within each province and territory. So we have some real question marks about, will it be through the licensed producers that exist? Will it be, with liquor stores, which was not something that the task force on legalization was supporting? Pharmacies, we've seen the pharmacists step up to the plate, like shoppers, saying that they want to have a piece of this new industry. And then we have the community-based dispensaries, which are an illegal source of cannabis, but may have existed in your communities for many, many years and have been used by many people seeking medical cannabis before there was authorization through legal means. So very briefly, for those of you that, maybe didn't see the news last week, Bill 45 is really focusing on harm reduction. They've set a minimum age of 18 years. Different provinces and territories can choose a higher age for access. The legal amount that you can possess, apologies for the spelling mistake there, is 30 grams of legal cannabis, and that is either dry or fresh plant material or oil. Nothing else at this time, including edibles, will be legal. There's a lot of restrictions, very similar to tobacco in terms of how this is advertised, really with the goal of not appealing to teenagers and to children, and that there has to be some clear markings related to THC and CBD, as well as warnings related to the potential side effects of using cannabis. They have incredibly strict penalties for those selling and engaging youth. It's up to 14 years in prison for selling or engaging a youth in the production of cannabis. They also have created some legislation around ensuring that there's public health education around risks and problematic use. And they're really going to be pushing the provinces to have a price and tax system that's going to balance health protection with a reduction of the illicit market. So you can't tax this to the point that the black market will still exist because it offers a cheaper source of cannabis. There's also a real focus on creating a safe and responsible supply chain. As I've mentioned, they're really going to be focusing at the provincial level, so we could potentially have some provinces that will not legalize any retail space in their province to offer cannabis. And if that does occur, the bill suggests that we'll have direct-to-consumer mail order through the LPs if retail services are not made available in a geographical region. In terms of personal production, people are going to be allowed to grow up to 4 plants per resident. It's not 4 plants per person. And it has to be grown from a legal seed or seedling, and the maximum height is 1 meter. And that there has to be some responsible growing and security measures. Again, they want to restrict any type of diversion to the illicit market, access by youth, and ensuring that we don't have mold or electrical fire issues and those sorts of things. And I found it kind of amusing, but not a surprise that Canada had to throw this out on Twitter the day after, because everyone thought, yay, they tabled the bill, it's legal, I can go and smoke in public now. And they had to kind of clarify that cannabis is still illegal to be used for non-medical purposes. And unless you have an authorization, you still could be charged under the current statutes that exist. And so we will continue to see dispensaries being raided, and people may still be charged with possession. So that may be an important point for some of your members to remind people that we're waiting until July 2018 before this is actually legal. The other interesting part of this legislation is the accompanying Bill C-46, where they did some revisions to impaired driving statutes. They really have been hammering quite hard about the public awareness around the dangers of driving under the influence of cannabis. There has been a lot of concerns about the potential, particularly youth, teenagers, of driving while high. We need a lot more research on this, to be quite honest. We know from the driving studies that have been done in simulators that using cannabis and then driving, that your coordination is less, your concentration is less, and your reaction time is less. So there is some concerns. However, some of the epidemiological research has suggested that when cannabis becomes legal, we see less traffic accidents. And that's probably because we're seeing a reduction in drinking and driving. So there's a lot of research that needs to be done. We actually do not know at this time what is a level of impairment in terms of how much THC is in the bloodstream. We also are still testing the roadside machines, especially this legislation is suggesting that a police officer, a law enforcement officer, can demand an oral fluid sample if they suspect someone is a driver has drugs in their body, which may be challenged constitutionally because it usually has been that you need reasonable grounds to suspect that. You smell cannabis, you see glassy eyes, red eyes, you see someone that's not responding appropriately to questions. So there's been some legal debate in the last week that this may not hold up in court. But the other big issue is that the machines we're using for the oral fluid samples have not been standardized. We don't know if they're reliable and valid at this time. So there's a lot of work that needs to be done. This legislation, though, does suggest that there will be kind of a graduated penalty system, that people that have a certain amount of THC within 2 hours of driving may get a fine up to $1,000. For those that are over 5 nanograms of THC within their bloodstream within 2 hours of driving, they could have a fine as well as potentially be indicted and face jail time. So they're really hammering this quite hard, that just because this is legal, we need to avoid some of the public health issues, particularly around driving impaired. You know, I wanted to just touch on a little bit some of the concerns that I've had in terms of legalization that should be legalization of cannabis. And as we legalize non-medical cannabis, what's its impact on the medical cannabis system? The task force very clearly said that we need to keep both the recreational and the medical system separate, and this bill is continuing that. However, there is some concerns that the licensed producers, as cannabis becomes legalized, they're going to be focusing on developing a higher and higher concentration of THC to achieve that high that people want in the recreational market. That is not necessarily what people want to achieve when they're using it for seizure control, where they're really focusing on things like the CBD or other cannabinoids. So there's a concern that the cannabis and the types of cannabis that are going to be developed are really going to start swaying towards the recreational and not have the same type of development around medical forms of cannabis. There is some concerns about costs, that, you know, with two separate systems, and as we legalize, is it going to, you know, decrease the cost, or is it going to potentially increase the cost when we have more of a marketing system that's going to be expensive for these companies? We also, you know, I mentioned the quality and type of cannabis. It's also, I'm concerned about the stigmatization associated with cannabis. You know, we see this focus on public health and we see this focus on driving impaired. We've seen a lot of youth groups and you know, pediatric groups come out. And now we're starting to see all the research funding coming out that's only focused on recreational use and the public harms. And as that research gets conducted, the emphasis is really going to be on the negative effects, and it's going to just further stigmatize cannabis use and its dangers. And we're not seeing the same type of attention to research on the therapeutic possibilities of cannabis. I do think we're going to see more education to consumers, which I think is a good thing. But as I said, I think we're really going to be focusing away from medicinal properties of cannabis, much more towards the social harms. I'm going to touch really briefly on just some of the experiences that I've seen patients have had under the various regulatory systems. When I was at UBC, we did the HEMP study, which was the Health Effects of Medical Marijuana project. And we were really just interviewing patients to say, what has been your experience under the MMAR regulations in accessing cannabis? And we heard a lot about gatekeeping behaviors by physicians that were refusing or delaying by up to 2 years of signing medical documentation for people to access it legally. They said that they felt significant stigma and labeling in asking to use medical cannabis, not only by healthcare providers, but also through law enforcement, as well as social services like public housing. And, you know, these are people that said, you know, I'm living with HIV/AIDS, I'm at end stage cancer, and I asked for cannabis and I got a prescription to go for addiction counseling, which really people struggled with. You know, people that were living in social housing, if they got caught, you know, using medical cannabis, they were kicked out of their housing unit. And in many ways, they felt that they were underserved populations living with disabilities, living with mental illness, living with chronic pain, and they felt that they were being further marginalized by their medical cannabis use. And when they talked about accessing, the cannabis that was available through the MMAR, they were really dissatisfied with the product. And they really ended up going to the dispensaries and the street to get product that they felt was better for them and better treated their symptoms and health conditions that they were dealing with. And in the end, they said, the health benefits that I'm getting from using medical cannabis far outweighed any of the health or the social risks, including being, basically labeled a criminal, through the legal system. So we followed up with this study when the MMPR came out, and we did a much larger national survey of people that were accessing cannabis under the MMAR, under the new regulations, as well as through illegal sources. And people reported using medical cannabis for a whole host of reasons, but pain, arthritis, and mental health were the ones that came out on top. And again, the reasons they were using medical cannabis were numerous. Pain relief was mentioned by almost everyone, but we also saw people using it for sleep and mental health issues, for overall well-being, as well as very specific symptoms like nausea and vomiting. And it was interesting when we talked to people that were under the legal system, they still used illegal sources. Nearly 3/4 of our study sample said, I'm still accessing it through illegal sources. And that was mainly because they had difficulties in accessing medical cannabis. Excuse me for just a moment. Number one is the group under the new regulations said, I really can't afford accessing my cannabis only through the legal system. I sometimes have to go to the dispensaries or to the street because I can't afford to go through an LP. There also was this huge issue around availability, that people, as the LPs were getting off the ground, would find a strain and a product that worked for them, but then they would go next month to order it again, and they would be told it was sold out. And they'd have to go back to their physician to get another authorization, to get assigned to another LP, and then try the various strains and types until they found one that worked. And then that one would be out of commission and would no longer be available. So it was a very frustrating process for many patients. And then for some, the registration wait time through the LPs could be 3 to 4 months. And if you're living with an end-stage, terminal illness, that may be not appropriate. And in terms of affordability, what was really interesting is that, the most affordable was people were producing it themselves or doing a designated or personal production. The least affordable was Health Canada system or through the licensed producers. And in terms of satisfaction, people also said that I went to illegal sources like dispensaries, like friends and acquaintances, because I felt that I got a better quality of care. I got more information and expertise in consulting those individuals or those businesses. And I felt that their administration, in terms of me gaining access and going through a registration process, was much faster. However, that being said, people that were going through the legal systems, they still were interested in being part of the legal system. And for people, when we talked to them, they said, I want that card. So if I get stopped by the police or someone challenges me on the use, they know that I'm using it for legal purposes. And they also wanted to have that follow-up from people and from a healthcare provider or from someone experienced with medical cannabis to ensure that they were getting the most they could out of their medicine. Now let's touch on some of the potential risks and benefits of cannabis. And I think there's been some real misnomers that this is a benign product. Most Canadians, think it should be legalized. They don't see it as being harmful. And I think as health professionals, as nurses, we need to recognize that, like any medicine, like any type of product that has an impact on our body, it can have positive and negative effects. The one thing I want to talk about in terms of, before I dive into some of the research, is that most of the research, particularly around the harms associated with cannabis, is from high use of cannabis by recreational users of cannabis. So these are people that are smoking, 3 or 4 joints a day. So, this may not be the same type of effects we see for someone that is, a weekend, went to a party, had a couple of tokes. So I think we just need to be conscious of that there's a gradient here. Also, most of the research on benefits around cannabis, because it's been an illegal substance, it's been very hard in North America, as well as places like Europe, to do research on whole plant cannabis because we haven't been able to gain access to it. And even to this day, to do a study with whole plant cannabis from a legal source like an LP, it takes it up to 2 years to get approval for that research project. And considering most of our funding is only for 3 years, it doesn't give you a lot of time to do the actual research. So in terms of some of the safety concerns that we have seen in the literature, there are some very clear physiological effects when people, particularly when they smoke cannabis. We see cardiovascular effects. People tend to have a sudden increase in their blood pressure, their heart rate, and it can cause arrhythmias, particularly for people that already have some type of cardiac disease. We have seen, although we often associate this with managing nausea and vomiting secondary to cancer treatments like chemotherapy, it can cause in some individuals a hyperemesis. And this is a known phenomena that sometimes people don't recognize and they just think their cannabis isn't working. And hyperemesis, the only way we've been able to find clinically to stop this repeated throwing up is by having someone take a very, very hot shower. And it seems to actually, for some reason, physiologically stop that mechanism from happening. In terms of lung, we do know that when people smoke it, that there's an irritation of the bronchial tubes, and that for people that are living with asthma, it could worsen it. There's been a lot of interest in the role of cannabis in terms of lung cancer. There's been one individual that's been looking at this for 10, 15 years, and we have not been able to find a clear link. People do not smoke cannabis the same way they smoke cigarettes. And we haven't been able to find that link. That's not to say that it's not there. I've seen studies at the bench level that have shown that it does cause lung cancer, and I've seen studies that show it actually prevents lung cancer. So the jury is still out on that role. In terms of contaminants, you might have seen in the news that even the LPs were found to be using pesticides that are actually not legal for human consumption. So that is an issue that's going to have to hopefully be addressed through these new regulations. And it's something to be aware of, that when you're seeking or using cannabis from a street source, that we have started to see some instances of contamination by street drugs, harder drugs, that could lead to further addiction issues. In terms of interactions with other medications, this is an important issue that, THC and CBD are kind of processed through the P450 cytochrome pathway, as well as some of the particular CYP metabolism pathways. And so if they're using this for medical purposes, or if they're, a daily user and they're on other medications, they may want to consult with a pharmacist or with their nurse in terms of whether it could potentially be clearing medication too soon from their bodies, or could it be keeping medication in their body too long. We do know it can potentiate some forms of sedatives like alcohol and barbiturates, but there's been one research by Donald Abrams at UCSF to suggest that it actually doesn't potentiate opioids, but that's only been one study with 22 people. So we need a little bit more research to know whether it's dangerous to be using cannabis alongside opioids. Because of some concerns about the impact of cannabis on the development of the embryo, as well as on the development of the human brain in childhood, it shouldn't be used during pregnancy or during lactation. And this has been going to become more of an issue as I'm hearing more and more women are trying to handle their morning sickness by using marijuana because they perceive it to be a safe alternative. I've mentioned a lot about public safety and driving. And again, there is a real I see within the youth community a thought that, instead of drinking and driving, I can go to a party and smoke and drive, and it's not as dangerous. And you hear I'm a slower driver and I concentrate more when I'm high. We do know that there's impairment associated with this, and if people are daily users, there needs to be a conversation about the impact on their driving. There is some work safety issues. I've heard a lot from the construction industries that they're seeing some of their workers are smoking during breaks. This could impact them in terms of safety. And then obviously there's the personal production issues. And I've mentioned most of these already: fires, mold, home invasions, as well as diversion to minors. In terms of cognitive functioning, this has been a real focus from a lot of the pediatric societies. And, we have enough research to know that when children, youth, teenagers are using this on a daily basis, we are seeing impacts on their concentration, on their short-term memory, and on their overall motivation. And there's been some indication that we see a drop in IQ levels by up to 10 points. And that's why there's been a lot of discussion about whether 18 is the right age, or should we actually be going all the way up to 25? And there's been this balancing act legally in terms of if we go 25, we're still going to have the illicit market active to serve the youth. So that's why I think the government went for 18 years. Mental health issues, this has been a really controversial field. In terms of, I never use the word addiction because I don't see the same type of withdrawal behavior with cannabis that we see with other addictive substances like opioids. However, there most definitely can be disorders, abuse disorders associated with cannabis, and there can be a dependency where people may struggle with sleeping, they may have a psychological craving for it, but we're not seeing people having the physiological withdrawal symptoms as severe as with others. And the overall disorder, cannabis disorder prevalence is about 9% for people that are using on a regular basis. There's also a concern that people that have psychosis or have, a likelihood of developing psychosis or schizophrenia, that using cannabis seems to increase its onset. They haven't necessarily, said that cannabis causes schizophrenia and psychosis. They're more thinking that it seems to make it come on board more quickly with individuals that have that predilection towards it. Anxiety has been interesting because we see some individuals that become highly anxious and paranoid on using cannabis. These are particularly within naive users, but then we see other individuals saying that they're using cannabis to help manage their anxiety. So a lot more work needs to be done around this. I've mentioned a lot of this already in terms of youth. 28% of Canadians in a UN Children Fund survey suggest they're using cannabis. And there's been some argument that legalization is not going to see an increase in youth use of cannabis because whoever's using it already has access to it, and we basically have reached saturation in terms of the market that's likely to use it. As I mentioned, there's some real concerns on brain development and how that impacts their educational and work attainment and achievement. And as I've mentioned, we have this issue around cannabis use disorder as well as the potential for psychosis. Hence, there's been a lot of health recommendations that it should be avoided until after the age of 25 when the brain's fully developed. Now let's turn to some of the more positive aspects of THC and CBD. I pulled out for you a whole bunch of systematic reviews, including Cochrane reviews, which have really tried to summarize some of the work that has been done. And we do know that, cannabis can have an analgesic effect. It can help with sleep, such as insomnia, sleep latency, sleep apnea, as well as nightmares that are secondary to PTSD. We know that in cancer care, it can be effective as an antiemetic, particularly for people that aren't responsive to the antiemetics that they've been taking. In terms of anti-seizure and anti-spasticity, there is good evidence, particularly around CBD, that it does have this impact. And there's some beginning research by Zach Walsh, who's at the UBC campus in Okanagan, that it may have a role in managing PTSD, particularly among veterans. And we've been seeing them as being a population that uses cannabis to a large extent to help manage their anxiety and some of their PTSD symptoms. I'm not going to go into this in great detail, but again, this is just showing you some of the research, the clinical trials that have been conducted on various cannabinoids. Again, as you'll notice here, most of the research has been done on the pharmaceutical forms of cannabis because it's been so difficult to use the herbal cannabis. What has been done with herbal cannabis, though, has been around peripheral neuropathy related to HIV and neuropathic pain. We also have seen Mark Ware from McGill do some work on post-trauma neuropathy, post-surgery, as well as there's been some beginning research around spasticity secondary to MS. So a lot more work that needs to be done. CBD has been a little bit easier to do research on because it hasn't always in all countries around the world been part of the Schedule 1 of controlled substances. And what's been interesting is it's been used a lot in mental health issues. So addressing things like paranoia, and this is the interesting one. The first one is that when people use very high concentrations of THC, they can have this paranoia develop. And when they use a more balanced cannabis that has high levels of CBD with it, it seems to reduce this likelihood around paranoia. We also have seen it almost as a substitution for things like cigarette use. And there's beginning interest of the role of CBD in helping people withdraw from such things as opioids. It's also been used to manage anxiety with social phobias, as well as treatment-resistant schizophrenia. And epilepsy has been something that's been on everyone's radar for many, many years. But we still need to do more research, particularly in the pediatric epilepsy field. But there needs to be a lot more research. We're really just at the beginning of understanding the medical effects of cannabis. Now that it will become legal in Canada, we're really hoping that this will open the door for more type of research. We really need to understand the whole plant and not just be focusing on its individual constituents, because most people are using it in the whole plant form. In my field of oncology, there's a great deal of interest in its role as a cancer treatment. And we just saw Setivex, which is a nasal spray that combines THC with CBD. It was shown to increase longevity in people living with advanced glioblastomas, brain tumors, by 200 days, which is very, very significant. So we need to have a larger phase 3 trial done now, but it's very promising that it may have a role in the treatment of brain tumors. There's also some interest in its role in such things as skin cancer. The other thing which I mentioned is that while we often talk about cannabis as being a gateway drug into addiction, there's beginning research to suggest it could be a gateway drug out of addiction and helping people manage their withdrawal symptoms, and that people are using it as a substitute. And with our opioid epidemic, this may be a really important thing to be considering to try to get people out of addiction. So very quickly, I just want to kind of run through, some of the clinical implications. We do have prescription cannabinoids in Canada, things like nabiximols, nabilone, and dronabinol, and we have seen them being, prescribed in Canada for things like nausea and vomiting secondary to chemo, MS, as well as dealing with HIV/AIDS and some of the nausea and vomiting and anorexia that's associated with the disease, as well as treatments. In terms of cannabis strains, I think it's important that, we're still trying to understand that there's hundreds of strains, but patients are often talking to you about indica and sativa. And, the word on the street is that indica is more sedative, more of a sedative, and sativa is more stimulating. But we need more research to really kind of understand that. And we're really kind of basing this on the patient's own experience when giving them advice. There's a whole different, routes that can be used in terms of administering cannabis. Smoked is how many people like to use it, and that's mainly because it allows them to titrate it and get a more immediate effect. Because of some of the concerns in terms of lung health, we've seen a movement towards vaporization, where, you have less particulates going into the lung when you vaporize it. And now we're starting to see more interest in the oral and the buccal routes, like tinctures, the edible products, as well as some of the sprays. And topically, for things like skin cancer and for skin conditions, people are using topical agents. This is just an example of a vaporizer that Donald Abrams created at UCSF so that he could really understand the percentage of THC that people were getting and to limit the amount of exposure to people around them in a hospital setting. Dosage, this is a big question mark, and it's really a moving target, but we're starting to get a lot better in understanding it. If you look at the Health Canada data, the majority of Canadians that are using medical cannabis are using about 2.6 grams a day, which an average joint ranges up to 78.75 grams. So we're seeing people smoking about 1 to 2 joints a day. In terms of vaporization, because vaporizers are so new, we're just starting to understand the dosages and how it impacts the plasma. The advice that we're typically giving to people is that you should start as low as possible and slowly increase, watching out for any of the potential negative side effects. And I've just included a chart that kind of shows that you need to consider not only how much they're smoking, but what percentage of THC is in the product that they're using to really understand how much THC they could be potentially consuming in an average joint or within, something that they're vaporizing. Mark Ware put together this really great slide that he allowed me to borrow, that these are some really key issues, that we need to do a complete evaluation of the patient. This should not be something where people are popping into, a roadside clinic where they've never been seen before, and they're walking out 10 minutes later with a prescription. You really need to understand the patient, what they've tried in the past, what their health conditions are, before an authorization is done, and that there needs to be a real relationship here, that is prolonged and not something that's a one-off. Obviously, there has to be informed consent, and good information being provided to the patient in terms of their choices related to cannabis, and that whatever decisions are made, that they're communicated with the whole healthcare team. And we need to be looking for these contraindications and precautions, heart disease, psychosis, and then all the legal issues, is this somebody that, has had an addiction issue in the past? Have they used cannabis, previously? Are they truly seeking for medical purposes? And this is not a first line treatment for many individuals, although I know there's an argument, particularly with the opioid crisis, that this should be more, frontline, for managing pain. Right now it's really seen as a second or third line treatment. And that there needs to be meaningful treatment goals, and they need to be followed up, so that if you do not see the goals being achieved, then you need to move on to another medication. And nurses are going to have a huge role related to harm reduction. I've heard rumors from the Canadian Medical Association that once this becomes legalized, they're going to tell patients to figure it out themselves. They can go down to the store and pick it up, that they don't want to be part of it. So I really see nurses as taking a leading role in trying to, assess for problematic use and ensuring that patients are having access to evidence-based education and support in making decisions about using cannabis. We can make recommendations about using cannabis and driving. We can encourage them to try routes other than smoking, and we can talk to youth and to families about trying to limit use, early on in life. So, we need more research, and I think this is where nurses are going to have to stay really current with the literature that's coming out. We need to better understand things like strain, dose, and route of administration. We need to understand what Canadians, information gaps are, and we need to have much clearer health policy, not only, at the federal level, but in our own, profession, around what the role of nurses are related to cannabis. And we need to be recognizing the public health impacts as we move towards legalization. And it was really fun last night to kind of read through some of the regulations that are already existing, and it's great to see that LPNs are recognizing that, you have a role in supporting people that are authorized, to use medical cannabis, to help them in accessing this and helping them to use it. You need to ensure that your members have that competence and authority to assist a client. And that's not just, at, a provincial level. It's also, related to their institutions. Will they need an order? Do you need to have, how will you document cannabis use? How is it going to be stored and disposed of, within a facility? Those are all issues that need to be teased out before an LPN, can step into this kind of arena. And you need to assess your own, the competency of a patient to ensure that they're not going to, go and light up a cannabis cigarette and then cause harm as a consequence of that. Just going back to some of the standards of practice that were mentioned in the LPN material, we need to respect that there's diversity in clients' experiences and their beliefs and values related to using cannabis as a medicine. And we need to be non-judgmental and respectful of that. We need to make sure they're informed in their decision-making and they're part of the decision-making process. And we need to be really advocating for policies at our institutions, in our organizations, within our profession around this cannabis issues. And we need to be conscious of our code of ethics, that we will see people that are using it illegally. We may see diversion. We need to know how we approach this from an ethical manner, not to stigmatize someone, but to ensure that their safety is being protected. And there may be some individuals that object to cannabis being used, and if so, they need to know the proper way of supporting a patient and not leaving them in the lurch. There's some great resources out there. I encourage, all LPNs, there's this 130-page document called Information for Healthcare Professionals, produced by Health Canada, that has some great information regarding how to support patients in the use of medical cannabis. The Canadian Consortium for the Investigation of Cannabinoids has an annual education event that's open to nurses that it would be a great place to get that education. We're working with them to try to develop some education that's specific to nursing. CAMH at the University of Toronto has great information on mental health. And some other organizations. One I want to point out is the American Cannabis Nurses Association. They offer an online course that nurses are able to access. And I met the president just a couple of months ago, and